been a huge topic going through it for the past couple of years. And in general, the question being asked about it is, do we have the right to die? If we're in pain and we're suffering and we can't even move, do we have the right to tell our doctors to end it all? Or do we just wait for it to end? This question is being raised because of a new term of death called euthanasia, or assisted suicide. The name itself is pretty self-explanatory because, well, if you're, again, sick or hurt and you're dying, do you get the choice to decide that, hey, I'm done with this, I want to move on, please end my life. The idea of legalizing euthanasia had been in the court for years, but the people defending the right of euthanasia never really had a solid point until a girl named Gloria Taylor came into the picture. Gloria Taylor suffered from ALS for a number of years, and for those of you unfamiliar with ALS, it stands for amyotrophic lateral sclerosis. It is a progressive neurodegenerative disease that affects nerve cells in the brain and the spinal cord, causing your body to slowly lose muscle and bodily function. The oldest you get, the worse your ALS will get. In the most severe cases, all bodily function will be lost by the age of 18, meaning you're unable to move, eat, and basically speak. Gloria Taylor went to BC Court Appeal in 2012 fighting her right to die when she wanted to die. She did not want to live the rest of her life knowing she couldn't do anything and having to rely on other people. She wouldn't have been happy, but sadly Gloria lost her fight. Gloria lost her fight with the court and died the exact way she did not wish to die. In 2013, they still use Gloria's name to defend people's rights for assisted suicide. Dr. Donald Lowe, a Toronto microbiologist, made a plea for assisted suicide, saying he agreed and knew the importance of not letting people suffer. Even though he created Bill 52, and it was passed in 2014 by the National Assembly in Quebec. Also known as the Dying with Dignity Law, it allowed terminally ill patients to have medical aid in dying. The bill follows Europe's lead by extending the law's reach to experiencing unbearable suffering, but who may not be within months of dying, allowing Quebec to use assisted suicide. But even though assisted suicide was not allowed, or was now allowed in Quebec, it was not allowed in other provinces and territories. And that is why Gillian Bennett killed herself. She killed herself by ingesting a bunch of drugs because she suffered with dementia and she did not want to live that way. Before her death, she posted on her blog that, "I was afraid to become a burden to my family. I did not want to live an indefinite number of years of being a vegetable in a hospital setting." She wished that by killing herself, the case would reopen and they would reconsider assisted suicide. And thanks to her, not only did the case reopen, but it was accepted. In January 6, 2015, the Supreme Court allowed an appeal from the BC Civil Liberties Association, and on that day, the law was passed that assisted suicide was able to be given. If you ask me if I agree with assisted suicide, my answer would be yes. And why is this? Well, my mother is an LPN at an old folks' home back home called Vista Village. She has worked with those suffering from dementia and other sicknesses that just put them in the utmost pain. And that's hard for her to watch. And as a little kid, she would sometimes take me to work and I would work with her, seeing these people in pain, seeing them with dementia, not knowing where they are. They don't even remember who their family is. And what kind of life is that, ending with that way? My mom agrees with assisted suicide, and she has a big vision to me. So I too agree with it. I've also had a couple aunties with cancer. My auntie Angela, who had stomach cancer so bad that she's lost the last 15 minutes of her year, or 15 years of her life. And that was hard seeing her that way because not only did she remember me, but she couldn't remember that her son had a child. She couldn't remember that her sons got married. And that sucks. We knew she didn't want to live that way, and we didn't want her to live that way. So why let someone suffer that way? And my Auntie Tammy, she had insanely bad cancer. She had it for an extensive amount of her life, ever since she was 18. And her pain was so bad, and when she was in her deathbed, I remember seeing her so pale and so frail and so skinny. Nobody wants to see their loved ones that way, and nobody wants them to be seen that way. But although I agree with assisted suicide, I can also agree with the defense against. For one reason, it may go against a religion. But I don't exactly agree with this defense, because assisted suicide is a choice, not a must. If it goes against your religion, you can choose not to have assisted suicide. But if it isn't against your religion, you can choose to have it. Another disagreement is the person who may be administering into assisted suicide may not be in the right state of mind and thinking correctly due to the fact that they are sick. This one I do agree with. If you take my Auntie Angela, for example, she lost the last 15 years of her life. How was she supposed to even know she was sick? Sure, she could feel it, but she wasn't in the right state of mind to choose that for herself. Family members may not be comfortable with their loved ones administering into assisted suicide. This one I also agree, because nobody wants to lose their loved ones. Nobody is ready for that. But at the same time, again, they're sick, they're dying, they're in pain. The belief that the time we die should not be up to us. This one goes back up to it may go against religion. But again, it is our choice, because we do have the power to end our lives if we want to end it. Even though some of these are valid points, there was another issue brought up. If our animals are sick and wounded, we don't let them suffer. So why would we let our loved ones suffer? Here's some statistics on assisted suicide. Ipsos Reid survey, approximately 84% of people agreed with assisted suicide, meaning out of those who voted, only 16% voted against. BC, 87% agreed, 13% disagreed. Alberta, 82% agreed, 18% disagreed. Ontario, 85% agreed, 15% disagreed. And in Quebec, 84% agreed and 16% disagreed. 80% of Christians and 83% of Catholics who voted responded that they agree with legalizing assisted dying, which means, going back to the disagreement, that it may go against someone's religion, well, assisted suicide definitely goes against Christians and Catholics' religion, yet most of them agreed with it. 57% wrote that they have seen someone they love suffer and die and did not wish to see it again. So I say again, if we love someone so much, why let them suffer a painful death that not only they don't want to be in, but we don't want to see them in? After all, my life, my death, my choice. An assisted dying law would not result in more people dying, but in fewer people suffering.